Last month, I paid $25 for Ozempic. My neighbor paid $1,200. Same medication, same dose, same pharmacy, same city. About to show you exactly why this happens and how to make sure you're the person paying $25, not $1,200. The price you pay for GLP-1 medications, Ozempic, Wegovy, Mounjaro, Zepbound has almost nothing to do with the actual drug. It has everything to do with knowing how to navigate a broken system. In the next 12 minutes, you're getting the real costs for 2025 insurance loopholes. Nobody tells you about manufacturer programs that could cut your costs by 90% and strategies that could save you over $10,000 this year. Quick legal note, I'm not a doctor. This isn't medical advice. Always consult your physician. Some links may be affiliate partnerships at no cost to you. This breakdown is based on Dr. Rocio Salas-Whelan's book, waitlist link in the description. Let's get into it. First, let's talk list prices. Ozempic costs $935 per month. Wegovy is $1,370. Mounjaro sits at $1,060. Zepbound is $1,059. But here's the critical thing. Almost nobody pays these prices. Your actual cost depends on your insurance plan design, your pharmacy benefits manager, manufacturer savings programs, your specific diagnosis, which state you live in, and something most people miss entirely: how your doctor writes the prescription. Let me tell you about Sarah. She emailed me after her insurance denied Wegovy. She was about to pay $1,100 out of pocket. Then her doctor changed one thing on the prescription, switched from Wegovy to Ozempic, same active ingredient, and added documentation of her prediabetes. Her new cost? $25 a month. Same exact medication. Different insurance decision. If you're finding this valuable, hit that like button right now. It helps more people discover this information. And subscribe, because we're breaking down everything about GLP-1s, the science, the costs, the real results. Insurance coverage for GLP-1s falls into two completely different worlds depending on one word: your diagnosis. If you have type 2 diabetes, Ozempic and Mounjaro are FDA approved for diabetes management. Most insurance recognizes them as medically necessary. Typical copay after prior authorization is $10 to $75 per month. You'll still deal with prior authorization paperwork and maybe step therapy, but approval rates are high. If you need it for weight management, this is where people get stuck. Many insurance plans explicitly exclude weight loss medications. Only 40 to 45% of commercial plans cover GLP-1s for obesity. Medicare coverage is even worse. Stay with me, because what I'm about to tell you could literally save you $10,000 a year. Traditional Medicare Part D legally cannot cover medications prescribed solely for weight loss. It's been law since 2003. But if you have type 2 diabetes or prediabetes, Medicare covers diabetes-indicated GLP-1s like Ozempic. Same drug, different indication, different coverage. Some Medicare Advantage plans are adding weight management as an extra benefit, but read the fine print carefully. Here's what most people miss entirely: where you live matters. California, New York, Massachusetts, New Jersey, and Maryland now require large group insurance plans to cover FDA-approved obesity treatments. If you live in one of these states and work for a company with 50-plus employees, your insurance legally must cover weight loss medications if you meet medical criteria. Your copay could be $25 to $50 per month for a medication that costs someone in a different state $1,100 out of pocket. Geography shouldn't determine your health access, but right now, it absolutely does. So, insurance denied you, or you have a high-deductible plan, or you're on Medicare and it won't cover weight loss. What do you actually pay? You have more options than you think. Option 1. Manufacturer savings programs. Novo Nordisk offers a savings card for both Ozempic and Wegovy that can bring your cost to as low as $25 per month if you have commercial insurance. Eli Lilly has similar programs for Mounjaro and Zepbound, $25 monthly for up to 13 months for eligible patients. The catch? These exclude Medicare and Medicaid patients. Federal law prohibits manufacturer copay assistance for government insurance. Option 2. Eli Lilly's Direct Buy program. This is one of the biggest developments for 2025 that most people don't know about. You can buy Zepbound in single-dose vials instead of pre-filled pens directly through their Lilly Direct platform. Lower doses cost $3.99 per month. Higher doses are $5.49 per month. No insurance needed. No prior authorization. Same medication, same quality. You'll need to use your own syringes. but that's a small trade-off for saving $700 a month. Novo Nordisk responded with their own cash program Wegovy for $6.99 per month for any dose, or as low as $4.99 with their expanded savings card. Option 3 compounded versions. Compounded Semaglutide and Tirzepatide from telehealth companies and compounding pharmacies cost $199 to $500 per month depending on dose. Companies like Hims, Ro, Henry Meds, Mochi Health, and NewMed offer complete packages including the compounded medication, doctor consultations, ongoing support, and shipping. Typical pricing is $249 to $349 monthly for Semaglutide and $349 to $49 to $499 for Tirzepatide. There's a major development in compounding you need to know about. The FDA has gone back and forth on whether these medications are in shortage, which legally determines whether compounding is permitted. The situation remains fluid as of early 2025. Always verify your source is a legitimate licensed compounding pharmacy. You're getting actual Semaglutide or Tirzepatide, not research chemicals, and you have proper medical supervision with regular check-ins. Turn on your notification bell. Next video, I'm covering prior authorization strategies and exactly what your doctor needs and appeal letters for the highest success rate. If insurance denies coverage, don't give up. The appeals process works more often than you think. 30 to 40% of denials get overturned on appeal. A lot of people accept the first denial and walk away. That's exactly what insurance companies are counting on. Your doctor needs to document your BMI, usually requires 30 or higher, or 27 with comorbidities. They need to document comorbid conditions like hypertension, prediabetes, or type 2 diabetes, high cholesterol, sleep apnea, fatty liver disease, or PCOS. They need previous weight loss attempts, diet, exercise, other medications, and they need obesity-related health complications or documented risks. Here's what insurance companies really don't want you to know. The way your doctor frames the request can mean the difference between approval and denial. Weak framing says patient wants to lose weight. Strong framing says patient has chronic obesity with metabolic dysfunction requiring pharmacological intervention to prevent cardiovascular disease and diabetes progression. See the difference? Dr. Salis Whalen discusses extensively in Weightless how obesity is a chronic metabolic disease, not a lifestyle choice. This framing is absolutely crucial for appeals. If the first appeal fails, request a second-level review with a medical director or request external independent review available in most states. Don't give up. Your doctor's office does this daily for various medications. Those odds are significant. Fight for your coverage. If you know someone struggling with insurance denials right now, share this video with them. This information could mean the difference between giving up and getting coverage. Let me give you 5 actionable strategies that can dramatically reduce what you pay. You can start these this week. Strategy 1. Check manufacturer websites before filling your prescription. Go to novonordisk.com/patient-assistance or lilly.com/savings. Don't check once and assume that's it. These programs change quarterly. Some people qualify for completely free medication based on income, and the thresholds are higher than you'd expect. Middle-class families making $60,000 to $70,000 sometimes qualify depending on family size. Fill out applications even if you're not sure you qualify. Worst case, they say no. Strategy 2. Compare pharmacy prices. Don't assume your regular pharmacy is cheapest. Use GoodRx or SingleCare to compare cash prices. Sometimes the difference is $200 or more for the same medication at a different location. You usually can't combine manufacturer coupons with discount cards. It's either or. Check both before each fill. Pro tip: Costco Pharmacy frequently has lower cash prices than CVS or Walgreens, and you don't need a membership to use their pharmacy. Strategy 3. Time your prescription strategically. Here's a timing strategy very few people know about that can save you thousands. If you start in December, you pay toward your deductible in December. Then the deductible resets January 1st, and you hit your deductible twice in 2 months. If you start in January, you pay toward one deductible period and can budget for the full year. Exception if it's late in the year and you've already met your deductible, starting in November or December gives you those months at full coverage before the reset. Strategy 4. Ask about dose flexibility. Not everyone needs the maximum dose to maintain results. Talk to your doctor about finding your minimum effective dose after you've hit your goals. Dr. Salis Whalen discusses in Weightless how individual response varies. Some people do great on lower doses long term, which significantly reduces cost. Strategy 5. Know your state's laws and use diagnosis strategically. If you live in California, New York, Massachusetts, New Jersey, or Maryland, you have legal protections for obesity treatment coverage that people in other states don't have. Research your state's specific mandates. And here's an insider trick. Sometimes switching from Wegovy to Ozempic, same active ingredient semaglutide, can mean the difference between full coverage and total denial. If you have any degree of insulin resistance or prediabetes, which many people with obesity do, your doctor might prescribe Ozempic for metabolic dysfunction instead of Wegovy for weight loss. Same drug, same effect. Different insurance decision. Your doctor needs to understand these nuances. Next video, I'm dropping the exact maintenance dose strategy that can cut your monthly costs in half while maintaining results. Make sure you're subscribed with notifications on so you catch it. Here's exactly what to do this week. Step 1. Call your insurance before your doctor appointment. Don't go in blind. Ask specifically which GLP-1s are on your formulary, what the prior authorization requirements are, what your deductible is and how much you've paid toward it, and what your copay would be once approved. Step 2. Have an honest cost conversation with your doctor. A good doctor understands the best medication is worthless if you can't afford it consistently. Be upfront about your budget and insurance situation. Ask about flexibility in which medication gets prescribed based on your coverage. Step 3. Apply for savings programs before your first fill. Don't wait to see what you'll pay. Be proactive. These applications take 10 minutes and could save thousands. Step 4. Calculate 12-month total cost. If you have a deductible, your first few months might be expensive, but once you hit your out-of-pocket max, insurance covers everything. What's your total expected annual cost? That's what you should budget for. Step 5. Plan for the long term. Dr. Salas Whalen emphasizes in Waitlist that successful weight management with GLP-1s requires ongoing treatment for most people. What's your plan if your insurance changes, you change jobs, or the manufacturer program ends? Think through backup plans now. Let me recap the most important points. GLP-1s range from $25 to $13.70 per month, depending on your situation. Manufacturer programs can save you $10,000 plus annually. Appeals work 30 to 40% of the time, don't accept the first denial. New cash pay options like Lilly's Vial program mean access without insurance, and how your doctor writes the prescription can completely change your insurance decision. Dr. Tep, Rocio Salas Whalen's Waitlist, the science behind GLP-1s and your metabolism, is the definitive resource for understanding how these medications work. Links in the description. In our next video, we're covering how to talk to your doctor about GLP-1s, the exact questions to ask, red flags to watch for, and how to know if you're working with someone who truly understands metabolic medicine versus someone just capitalizing on a trend. You absolutely need to watch that before starting therapy. Here's what I need from you. Hit that like button if you found this valuable. Subscribe and turn on notifications. We're breaking down everything about GLP-1s and metabolic health. Drop a comment telling me what GLP-1 topic you want covered next, or share your cost experience to help.